Hi, medications part 2. Like I said in the previous video, there is no end to the names and doses and forms of medications. It will continue to evolve, new things will continue to come up, so it takes a while. So the best bet you have is to first learn or get used to the medications that are more frequently used in your unit. In my case, what I did was that I got a small notepad, and each time I encounter a new medication, I wrote the name down. I wrote the generic name down. I wrote 2 or 3 of the most common brand names, briefly write the uses and possibly the dose. So it just takes few minutes to do that. You can just take few minutes to do that. Each time you encounter a new medication, you write it down. So before long, I started getting used to the medications. So it is a patience game. So first start with the ones that are more frequently used, and then you go from there. Now, the most common medications, like I said earlier, in the United States, and I believe in other advanced countries, is pain medications and anxiety medications. I'm going to briefly talk about pain medications in this video. Pain management is a big deal. It's a huge deal. So, will I say they are generous with pain medications here? So every time it comes up, different types, the narcotics, the ones that are not narcotics, all that. But I want to particularly emphasize on the narcotic. You want to be especially careful with narcotics because of, the drug addiction problem. So whenever you give a patient a medication that is a narcotic, and for instance, you're supposed to give 2.5 milligram, but it comes in a 5 milligram dose. You're supposed to waste 2.5 milligram and then give 2.5 milligram. So that wasting, another nurse is supposed to witness that waste. You want to be very careful with that. Make sure you waste appropriately. Get somebody to witness. Another thing is, you may pull the drug from the medication dispenser, and then for one reason or the other, maybe it's not time to give it, or the patient does not want it at that time and you need to return it. Returning it, you will need a witness, somebody to sign off that you returned it. You want to be very careful with that, because any record that is against you, any negative record about narcotics, it's not good. It will be on your record, and it is not a good thing. So you want to be very careful with that. So that is one. Two is that you make sure, and another nurse will want to, if they want to waste or return, you will need to sign off. So be careful too that you sign off on what the person wasted, and then you sign off on what the person returned, because you don't want a situation whereby you get in trouble because of what somebody else is doing. You ought to be very careful as far as narcotics are concerned. Another thing, when you are giving those patients the medications, if it's a narcotic, 2 things. One, ensure that it's clear to the patient, especially if maybe the patient is not it's a little bit confused or anything like that. If there is anything in the scenario that makes things unclear, ensure that the person knows, or the patient knows, that you are giving him his pain medication, because some of the drug seekers may want to accuse you of siphoning their medications, and that may be a problem. If you're able to identify such patients, Ensure you have a witness in the room when you are giving that medication. I'm not saying that it's impossible for health workers to to siphon medications, but make sure you are in the clear when you go to give your medication. 2, another very important reason why you should be very careful is whenever you go in to give a patient a narcotic medication, stand there and make sure you observe the patient taking the medication. Why? Because some suicidal patients may stockpile the medication. For instance, the day shift now comes and give them their medication, they will take it and hide it. Night shift comes and give them, they will take it and hide it. Like that, they will now gather it and take it as overdose to commit suicide. So this is one of the most important reasons why you should make sure you stay there and see that the patient has taken his or her medications. So as far as narcotics are concerned, I want to emphasize again, the digital footprints are unforgivable. Once there is a record that you have a shady business with narcotics, it's not good for you. So ensure that you maintain a clean record, you have no issues with anybody. Like I said earlier, it is a patience game. Get used to the medication one day at a time. When you get used to the most frequently used ones, then you move on to other less frequently used medications. In the next video, I'll cover a little bit about anxiety medications and then we'll go from there. Thanks for listening. Make sure to like, share, subscribe, and follow for more.